it helped promote my life a lot better. The consistency of being able to take my drugs and being able to expound on my quality of life.
ADAP to the clients means life versus death.
ADAP plays a very significant role for our clients. Not only does it enable clients to have life-saving medications, but it enables a lot of our clients to continue to work and be productive members of society.
We fill a critical need in terms of providing payments for co-pays and premiums that really enable people who are poor to continue to receive their medications when they're faced with co-pays that would result in them just not having enough money to live on.
In my life, ADAP assisted me to prolong my life. I didn't think I would live. Back in the 80s when there was only just one drug, now there's several drugs, and the accessibility to have my doctor can just write out the drug and knowing that it's covered and I don't have to pay as much as for my medication.
One of the biggest challenges I think we'll see is maintaining the people that we already have on the program while continuing to enroll people as they lose their jobs.
We have ever-increasing numbers of clients who rely on ADAP to provide them with life-saving medications. And we have flat funding from the federal government. We have now flat funding from the state government. And so there's just nothing to fill that gap.
Our ADAP clients often go on and off the program. As they get employment, they go off. So we've been able in the past to rely on the inconsistency of people being on the program, for 12 consecutive months. But with this economic climate, I think people are going to be on the program a lot longer.
We went through a very painful process of trying to determine, were there any specific drugs that there may be an alternative for? That it may be more likely that there's a pharmaceutical assistance program for, that people could live without. There's no drugs on that formulary that people can live without. So it's always going to be a question of how else can they get those medications.
My partner happened to lost my meds, and I didn't realize how much they really cost, so I had the pharmacy to tell me the retail price of it, and it came up to $3,200. $3,200 for that for 30 days.
It's just a matter of looking for all these different funding resources and non-funding resources that you can garner to come to bear and provide a wider range of services to a wider range of clients in this time of dwindling resources and increasing client load.
The State General Fund can't fill in that gap. So for now, we're filling it in with the manufacturer rebates. But those funds are not going to last forever. We can't continue to support a growth program with manufacturer rebates, which are only a proportion of the expenditures.
Success can be defined in several ways. One is individuals receive optimal health care and that they do become productive members of society. Success on an administrative level is having enough funding to fund everyone that needs to receive ADAP medications.
The future looked bright. I mean, I'm looking to work continuously in helping getting people into treatment, helping to advocate for people living with HIV and AIDS. So it looks bright. Only the universe can brighten it even more for me.